I was working full-time in a kitchen in a restaurant. My backache, my stomach cramps, things like that, I put down to menopause, the job I was doing, you know, sort of, you've always got an excuse. And then I started getting really just feeling nauseous all the time. And I woke up one morning and my other half said to me, you're a bit yellow there. By the time I got to the doctor, and I saw four doctors who couldn't work out what was wrong, had an ultrasound a week before I was told that I had pancreatic cancer. And the fifth doctor took one look at me and said, you've either got stones or you've got cancer, and I hope it's stones.
As a GP, we don't normally see that many pancreatic ulcers during our practice. I myself see at best 2 a year. So our experience is pretty limited in that regard.
It's very hard to differentiate symptoms of pancreatic cancer from symptoms from many other conditions. Most symptoms, unfortunately, from pancreatic cancer are very vague. Some abdominal discomfort, really an upset stomach. And the causes of upset stomachs are 99.9% something else, and maybe a very small proportion end up being pancreatic cancer.
So we discovered that I had cancer very, very accidentally, actually, because I went for my run and I came last because I couldn't breathe in this particular race. And so I went to saw my local GP, and he said, let's do an ultrasound.
When my dad was about 58, he was diagnosed with pancreatic cancer. He'd been unwell for about a year or so, had very bad back pain, and the doctor had sent him off to have physiotherapy for it, but he hadn't got any relief from it. So, but nothing was investigated further until he became very ill.
I would like to draw people's attention. The early symptom is sometimes often regretted by most people, like a simple indigestion, and people often ignore that. But the thing you've got to take care of is you suffer from indigestion pain, especially at nighttime, they wake you up, and very often it go to the side and go to the left side or your back. Beware, because that might be the pancreas tumor is growing that give you the pain.
I normally get it in the middle of the night. I'll wake up and I have this excruciating pain, and eventually I went to the doctor and I told the doctor, I said, look, I've got these horrible pains. Could it be gallstones? Because I had similar pains in the past and I already had my gallstone removed. So I thought, you can't have gallstones again.
April 2 years ago, he was just having a bit of indigestion and perhaps eating a lot of quickies, and he said, then just one day he said, oh, look, I don't feel too crash hot, I'll go to the doctor. And I said to him, ask him about your colour, because I felt he was going slightly jaundiced.
Most patients with pancreatic cancer don't get diagnosed until they become jaundiced or yellow. This often starts with the urine going dark, and later the eyes go yellow and then the skin goes yellow. In retrospect, these patients recognise that they've had pain and discomfort for some time beforehand, maybe 3 months, 6 months or a year.
I started to get pains about the middle of last year in my upper abdominal area, and I went to the doctor and he sent me for a CT scan, and it was originally thought that I had diverticulitis.
Another thing that people that ignore is they lost weight because they had no appetite. Very, very often, this is the first presenting symptom. But people sometimes ignore that and say a simple indigestion.
The first indications that I got were that I started to lose my appetite, very poor digestion, and then I started to go jaundice. I noticed that my skin was getting darker, and I thought, I better go and talk to my GP about those symptoms. And he did several tests, and he thought initially that it may well have been hepatitis.
The third thing they got to look out is their motion. If you suffer from passing a lot of wind and also have loose motion, and the motion floating to the top of the bowl and very hard to flush away, beware, because there's a lot of fat in the motion due to the lack of the digestive enzyme from your pancreas. You need to go and see someone.
The pain continued, and he said, well, you better present to hospital, which I did, and they kept me there for probably about 6 hours and discharged me, saying, yeah, it probably is diverticulitis. And the pain continued after that, and I went back to the doctor, and he said, well, you better present again, which I did. And I went back to the specialist. He said, oh, well, you know, just don't drink alcohol, just carry on as normal, really, and we'll do another scan in 3 months.
Saying that don't worry about it, it'll go away, so far as the pancreas is concerned, is not really a good option in the 21st century.
So the theme is early detection and seek treatment. That's what I like people to be aware of.